here we are. This is Sex Love Psychedelics, and I'm your host, Dr. Kat, bringing you psychosexual conversations that will leave you intellectually turned on and hungry for more.
What type of psychedelics would you tell somebody that it would be counterindicative if they're on antidepressants?
Like SSRI antidepressants?
Sure, or other ones. Wellbutrin, I know, is another popular one.
Yeah. Well, let's just stick with like SSRIs or SNRI types of antidepressants, because if you start talking about disparate classes like Wellbutrin's a dopamine norepinephrine reuptake inhibitor, whereas I think like the SSRIs or SNRIs, yes, SNRIs block norepinephrine reuptake, but the sort of like the kind of crux of their mechanism is still blocking serotonin reuptake, right? So drugs that block serotonin reuptake are typically going to really diminish effects of MDMA, and that seems fairly clear. Fairly clear. Like we have several sort of phase 1 drug-drug interaction studies that have demonstrated that, right? When it comes to things like psilocybin or LSD, it's a lot more murky and like a lot less clear. First of all, psilocybin or LSD, they're two substances that don't really have like lethally defined doses. So if there was some blunting or diminishment of effect, it might be more reasonable to consider pushing the dose of psilocybin or LSD up higher to try to overcome that kind of medication blunting or resistance. Whereas I'm really unconvinced that that's a safe strategy with MDMA, because it affects a lot of neurotransmitters. It doesn't have the same safety profile in overdose. And I get very scared actually that people would take a normal dose of MDMA with an antidepressant, not feel much, and then just keep taking more and more and more, and actually just go from not feeling much at all to toxicity without really getting much of the experience they wanted in between. So the SSRIs are, go ahead.
I was going to say, what would be the symptoms of toxicity? So if somebody was going through that experience and they didn't know any of this information, what might tell them that they're experiencing that?
Well, so like the symptoms of serotonin toxicity, right, are things like myoclonic seizures, like hyperthermia, or like really high fevers. Like most psychedelics increase core body temperature like 0.5 degree centigrade, like on average, but we're sort of talking more like 38.5 centigrade, or maybe like 99.5, 100 plus sort of like fevers. That's kind of getting into, I'll say, like the danger zone. But like real serotonin toxicities, the fevers are oftentimes, 104 Fahrenheit plus. You don't want to wait that late in the game, right? Because things can kind of progress rapidly. I think if it's sort of like, wow, their core body temperature is up a whole degree centigrade, I would kind of take that as like there's some degree of hyperthermia that's sort of outside the norm happening here. And then mental status changes in the other one. And usually it's going to be more like agitated, combative, hostile, or if it's really severe, it could be more like comatose. But there's a whole lot of other signs and symptoms of serotonin syndrome or serotonin toxicity that are out there on the internet, from looser diagnostic criteria that include things like diarrhea, an upset stomach, dilated pupils, feeling a bit sweaty, having hyperreflexia, or being a bit twitchy. And it's kind of like, well, actually, a lot of those signs and symptoms would be consistent with an intense ayahuasca experience, or maybe just an intense psilocybin or MDMA experience. So, and the person's in this kind of state where they could be paranoid, they could be suspicious. So I think sometimes people get into what I would call like a difficult somatic experience with a psychedelic. And it's very tempting to go to the internet afterwards and diagnose yourself with serotonin syndrome or serotonin toxicity. And you will be able to look at it and be like, I was panicked. My pupils were dilated. I did have an episode of diarrhea. I was having stomach cramps. I was severely nauseous. Like they can go through these things and sort of like, I had it, right? But to me, I'm kind of thinking serotonin toxicity is a life-threatening toxidrome that you need to go to the ER, and you're probably going to get admitted to the ICU if you have it. Right. So if it's sort of like, I was at home and it was just awful for 4 hours, and then I kind of came out of it and I was all right the next day, but geez, I'm not going to do that again.
Yeah.
It doesn't sound like serotonin toxicity, right? At least in an extreme sort of version. And I think that's it, is like, okay, we're talking about serotonin syndrome or serotonin toxicity. That's like an extreme sort of level that's like poisoning, right? Serotonin poisoning would be a better term for it than serotonin syndrome, because it's not like this cluster of signs and symptoms. It's more like a type of poisoning linked with too much serotonin.
Yeah.
But you can get this sort of spectrum of serotonergic side effects. And even when people start SSRI antidepressants, you're counseling them, hey, in the next few weeks, as you adjust to this medication, you might have a headache, you might have some more anxiety, you might have nausea, you might have some sort of stomach upset. So it's like, okay, that seems like in the range of normal serotonergic side effects. You know, looking at clinical trials with psilocybin and MDMA, some of the most common effects that people experience, particularly in the come-up phase toward the peak, are things like nausea, transient anxiety, physical or emotional discomfort, right? So it kind of seems like, well, that's just kind of the flavor of stuff that you get when you push serotonin a little bit, where it's like really this extreme case, like hyperthermia, myoclonic seizures, agitated or comatose. Like that sounds more like, wow, we're in the realm of like actual toxicity now.
Well, that was fun. Thanks for tuning in, lovers. And if you want to experience more ecstasy and sexual liberation, head over to sexlovepsychedelics.com and learn about how you can join me for any one of my online or live events. And while you're there, grab my free guide on sex and psychedelics. Remember, this podcast is for entertainment and educational purposes only. Please contact your healthcare provider and local law before pursuing any of the products or psychedelics discussed. And one final note here. I make this show specifically for you. If you're loving the show, then be sure to leave me a review in iTunes or Spotify to let me know. Happy to be here and happy to serve. I'll see you next time on Sex Love Psychedelics.